like to find new ways to get healthy. Joining us today is Dr. Doug Andersen with Portneuf Medical Center, and October is National Breast Cancer Awareness Month, and so we're going to talk a little bit about how we can be involved and how we can get the necessary information that we need on breast cancer. So tell us, not just October, but why all year round we should be aware of breast cancer awareness.
Yeah, thank you. So breast cancer awareness is so important because breast cancer is a very treatable thing, and we can treat and avoid people getting into the situation where breast cancer takes their life by getting it early. And so we're really excited to try to bring breast cancer screening further throughout southeastern Idaho. I mentioned earlier when we had this break for breakfast that Idaho unfortunately ranks 47th out of 50 in the United States for breast cancer screening, those that are eligible getting it done. So part of that is that we have a lot of rural communities. So we have this mammo bus that comes to different events and to a lot of the surrounding communities, and so they can get it locally done, make it a lot easier on patients.
And that's something that's a really cool resource to have, because not just, especially when you mentioned the rural communities, getting to the hospital or getting to an appointment might be a little burdensome, but now this bus can go to where you are, and it goes all around eastern Idaho.
Yeah.
Yeah.
We are very lucky at Pocatello, being a relatively smaller city, to be able to have a comprehensive cancer team. We're able, because cancer treatment does take more than one person. We have social work and finance to make sure that that's all taken care of. We have the surgical team, the medical oncology team, being myself, taking care of anti-hormone treatments, chemo if you need it, things like that, as well as continued screening, and then radiation, the whole gambit we have right here in our smaller community. So it's wonderful.
And for a person who's watching, what are the ages do you recommend the mammogram or breast cancer screenings?
Mammograms generally recommended for when a woman turns 40 years old. If they do have a strong family history of cancer, that's something they need to talk to their physician about primary care, because screenings are generally started earlier for those patients.
And so it's never too early to talk about it with your physician, isn't it? So.
Correct. Yeah, get talking about it.
All right, fantastic. Dr. Andersen, thank you so much for joining us today.
You're welcome.